Hello and welcome to the Rogers TV COVID-19 show. I'm Carol Merton, and before I welcome our guest, I'd like to share a few thoughts with you. Here in Grey Bruce, we celebrate that we have entered the green or prevent stage of the provincial reopening framework March the 1st, 2021. This change to green reflects the hard work all of us have been doing by following the Public Health Unit guidelines. We must continue to wash our hands, watch our distance, and wear face covering correctly to be able to continue to enjoy this broader allowance of activities. We do face an ongoing concern regarding the possibility of individuals traveling to our area from zones that are red or locked down. The Health Unit has provided recommendations to businesses, minor hockey, and sports teams to help reduce the risk of exposure from any individuals traveling here from out of the region. However, we in the green zone of Grey Bruce also are being asked to avoid interregional travel except for essential needs, to limit our activities like carpooling, and to continue to limit to socializing to those within your household. There is even more good news heading our way with the rollout of the vaccine delivery plan and a pilot project. So for those who choose to be vaccinated, our guest today will be able to tell us even more about the delivery and the pilot project. Thank you to all of you for not relaxing your vigilance. We want to continue to enjoy being in the green zone and want to do all that we can do to stay green. The sacrifices that we make each and every day are helping to prevent the spread of COVID-19. We are all making a difference. So thank you. And thank you to our guest who's appearing today, Dr. Ian Arra from the Public Health Unit. Dr. Arra is our Medical Officer of Health and Chief Executive Officer for the Health Unit here in Grey Bruce. Dr. Arra, thank you so much. You can tell from my intro, I do read your news releases.
Thank you, Carol, for having me. You did cover everything. I think the interview is over. You said it better than me.
Oh, no, I know you've got more news to share. So I'm going to ask you to give us some more of the good news, but also information you want our community to know as we move forward in this green stage and, of course, the vaccine rollout. Where would you like to start?
So I think we can start with the positives. All of it is positive in a way or the other. Any challenge could be turned into a solution. We need to find solutions for problems. So I tend to see any challenge as an opportunity to actually improve. But the really good news is the 80-plus group, older adults, are started receiving vaccines in Grey Bruce. And we know that not everybody's going to receive the vaccine on the first day. It's going to be person after person. And nevertheless, within months, we should complete that age group. And that's a provincial direction. And as long as we have enough supply from vaccine, we will deliver. We have piloted for the province a software for booking online and by phone. And I know this is something that the public has been looking forward, and we've been working on it for actually quite some time. We cannot speak about it because there's embargo over these initiatives for good reasons. Sometimes if when they are piloted and if there is overuse by the public to the software, it will collapse while it's being piloted. So there was quite the work around it, and it was delivered from our side, and we will continue to work to finalize this pilot. The announcement from the province would indicate, that came out a few days ago, would indicate that the system would be available for public mid-March, March 15th. And by that date means everybody who qualifies for the vaccine can go to the internet and register themselves and book an appointment. And if they don't wish to use the internet or don't have access to the internet, a phone line would be available. I know from relatives who are over 80, they will tell me I will call the phone number 10 times, 200 times. Don't give me an email address or a link, which is quite all right. We will deliver either or. So locally, we started mapping out this group through family health teams in collaboration with the physicians in the area, and it has gone really well to map out majority of people. We know we're not going to capture everybody for different reasons. Some people don't have a family doctor. Some people have a family doctor outside of Grey Bruce. So for these two groups, the system March 15th will be available to register themselves. And I would like to reassure everybody, there will be enough vaccines. We don't have at this point, and the barrier is the supply of vaccines. But this issue will be resolved and actually reversed. My understanding from the province and the general that by end March, early April, we're going to have plenty of vaccine, and the main challenge for many health units would be to keep up with putting vaccines in arms. And to that end, I have a high level of confidence in the plans we have. We have plans to deliver the vaccine to all communities that requires it through the two systems mainly. The first one is the traditional system, family health teams and pharmacists, and we will support them in this process. We will go even further to have mass immunization clinics close to their practices in the community. And we did this through the task force where the counties communicated with the municipalities to map out any organization that would provide larger space for mass immunization. You can appreciate a pharmacist can have a couple of chairs. So if people are going to be waiting 15 minutes, the capacity of vaccinating is going to be very limited. So we will provide them with spaces close to their clinics. If they're willing and available, you will find these clinics rolling in Grey Bruce. This week we had 35 clinics booked in Grey Bruce, smaller clinics, just because of the amount of vaccine we're supplying, we're receiving. And beside that traditional system, we will have the mass immunization hubs and mobile units. The EMS have been very instrumental during the pandemic in testing and in rolling out the vaccine as well in the near future. And our team will provide it in the community as well. So that's all in all good news all around. The only barrier so far is we need bigger shipments. And it's a matter of time to get that.
So I wanted to drill down a little bit into the model, the delivery model, because you have various aspects of it. Where are you going to find the people to deliver the vaccines? And then I'm assuming you're going to need helpers, people who help guide people, register people. How will it actually look?
So that's an excellent question. And to answer it, it is a group effort. The healthcare workers, pharmacists, physicians, family health teams have their own resources. The health unit, we have a team of people who deliver the vaccine. We ask for people to send us their contacts if they're willing to be volunteers, and that list is growing by the day. We connected with Georgian College, and they have the will to support us with the nursing students. So we have combination of clinical volunteers and non-clinical volunteers, and all this group will be directed to support a family health team or a pharmacist or the hub in different capacity. Worth mentioning the volunteers, retired physicians and nurses. It really is warming when you see the emails coming and they're willing to help. And if our audience are interested in helping our website, if they can connect with our website and provide their information, and we'll guide them from there to see how we best can utilize their help down the road if needed.
It's a prime example of community helping community. Everyone coming together to be able to support the health unit initiatives and to get the vaccine into the arms of others. I mean, it's an excellent example of how we reach out and support everyone to being more safe, and that's critical. The vaccines, there's been a lot of discussion about the different types of vaccines, the time frame between when they should get a second dose for those that require the second dose. I'm wondering if you could explain a bit more. There's now, I believe, 3 vaccines that potentially could be available. And it's a little bit difficult to understand, the percentage of success and in the immunization. Can you fill us in a little bit more about the details? How do we even know which one we're going to get?
Certainly, this is one of the key questions. The three vaccines are licensed in Canada by NACI, National Advisory Committee for Immunization, which means they're effective and safe. And the bottom line to it, I will go through it thoroughly, but the bottom line, if one of these vaccines is available, I would recommend it strongly to the person who wants it immediately. And it doesn't really matter which type, all of them have a certain level of efficacy. And you look at Pfizer vaccine, Moderna, they have efficacy around 95% after second dose, which means if 100 people receive that vaccine, 95 of them will have immunity sufficient to prevent severe disease and complications. And 5 of the 100 might not have enough immunity. And the immunity is a system that changes from a person to person depending on age. The older we get, the less immunity we can mount based on the vaccine. AstraZeneca, my understanding, has lower efficacy. It's around 65 to 85, depending on a person. And the efficacy is reduced as we get older. So the AstraZeneca, my understanding, but it's not confirmed yet, will be recommended for people who are younger, just to ensure that level of efficacy is there. Regardless, if a person has the opportunity to get the vaccine and they have their schedule booked, I would not, or appointment booked, I would not hesitate to take any one of them. 65% efficacy is better than nothing. And we all need to remember something. This is not, one of these vaccines like measles. You get it once in lifetime and that's it. This is going to be like the flu or pertussis. You take it every 2 years or so to get the protection. So I would start with any level of efficacy, and be happy with it if it's offered to me. And if I may circle back to your previous question, I've neglected to mention a really important group of volunteers, the municipality and county volunteers. They've done a bang-up job supporting us in the hub planning and in the hub operations.
It takes all of us together, right, to make it work. I wanted to ask you here in Grey Bruce, the second dose, the planning of the second dose, how does it work? For when people register, they get the first dose. Do you set dosages aside for a second dose? And how are you spacing that second dose? Because we hear in the news a whole bunch of different time frames.
So based on the clinical trials, the second dose would come 21 days or 28 days, depending on the type of vaccine. And when the person gets their vaccine, we already have their date in the system. We can book them for the subsequent clinic. Going forward, it will be even easier, just because NACI, based on the new data, would recommend that you can extend this period from 21 or 28 days to 42 days. And recent recommendation is actually you can extend it longer. And this is expected. This is not change in science. Rather, the data was not available because the vaccine was new. And as we go forward in time, that period of time would be extended even more. For measles, you can get the 2 doses within more than 2 months in between, and that can include 2 years or 20 years. 2 doses are 2 doses. So the concern about booking the second appointment will be less important as we go forward based on this recommendation. Nevertheless, we'll take care of it from the Health Unit point of view.
And that's important for people to know, because they get confused. I certainly did about, well, first they say a certain time frame and now they're saying a different time frame. But what you're telling us is that the science is informing the decision around the timing.
Correct. And Carol, it's worth mentioning a similar point there. The clinical trials studied the vaccine on adults, not on children and not on pregnant ladies. So the recommendation from NACI would be to recommend it to these groups, not to children. Going forward in time, we will find that it is as effective and as safe in children. And that's the science of vaccine development. So it is really, it should not confuse anybody that the recommendation did not change based on change in science, rather on consistency in science and changed data.
And that's really an important point for sure. There are some who are vaccine hesitant, or they're just not sure what will happen when they get the vaccine. What will happen to them physically? What would you say to people who are just unsure? They're just not sure if they should proceed, and what would cause them to change their mind from being hesitant to being convinced to be vaccinated?
Vaccine hesitancy or readiness is a subject that has multi-facets to it. It's probably worth, before answering the question specifically, how we can reassure the group and maybe provide information to help them make the decision, informed decision. It's worth looking at the percentage of people who are completely anti-vaxxers. That's a term that's used, anti-vaxxers. Those are very small percentage of the public, less than 2%, less than 1%, depending on different literature. They're just vocal on the social media, which is a new way to be a keyboard warrior, or certain terms that they use to describe their activity. It's very small, and in Grey Bruce, it's actually very, very small compared to other areas. In Grey Bruce, we have one of the highest above average provincial rate for vaccination, whether it's in school kids or in other groups, age groups. There are some people who are hesitant to get it. However, they would not mind it down the road. And that's maybe around 10 to 15% of the public in Grey Bruce. And there are multiple reasons. Some of it's related to belief, to religion. Some of it's related to, I just need more information. I need more data. I want to see it for 6 months or a year. And I want to make sure that nobody got sick when they got it. If we put all these reasons on the side and look at the process of developing vaccine, it's very rigorous. There's so much redundancy in it. And redundancy in this case is positive, because we want to make sure the product is safe. It's different from development of drugs or medication. Medication, you give it to somebody who's suffering already. So there is a predisposition to accept the fact that there could be side effects to it. In vaccines, we're giving it to somebody who's healthy. So the threshold to accept it is very high. Like, there shouldn't be any complications that are severe. And from the data that I last heard a couple of weeks ago, after vaccinating around 400,000 people in Ontario, only 2 cases had some severe reaction to it. And I don't know if there was hospitalization or not, but it wasn't severe enough to cause permanent damage or death. So vaccine development is a very robust process. And the fact it's licensed, that means it's safe product and effective product.
Excellent. And that's really important. I'm glad that you shared that information, because people, it's a decision they have to make, but it's also a decision that impacts all of us, for sure, in a community.
That's a really good point, Carol. And if I can elaborate a bit there, I would encourage people who are hesitant to get the vaccine to get the information, credible information, Public Health Agency of Canada, Public Health Ontario, the Health Unit website. Look through this information, and it might take, a day or 2 here and there, a couple hours to read that, and a person can reach the conclusion based on information, rather just rejection or based on social media.
Yeah. So when in doubt, check out the information. Absolutely. Now, I also read on a media release that Grey Bruce is providing a vaccine freezer to another county. And I wonder if you'd talk about that initiative. It's sort of a way of paying it forward in a way, is it not?
Definitely. And it really, the credit doesn't go to the health unit only. It goes to multiple partners to make it happen. And I'll explain why and how. Chapman's Ice Cream donated 2 freezers for the cause, and they're vaccine designed freezers. I get the question, is it an ice cream freezer? It's not. Bruce Power donated a third one, and we have 3 hubs and the health unit in Grey Bruce. Those are the places where you can place a freezer. Being efficient in the way we do our work, we can operate the hubs through 1 freezer, so we can donate 2. Nevertheless, when you look at emergency, and I used this word a bit earlier, redundancy is a virtue in emergency. I don't want a freezer that has 50,000 doses at some point to malfunction and we have no backup. So having 2 would allow us to donate the third one, and it's a donation from Chapman's Ice Cream. There is a lot of goodness in the community and the companies in the community as well. So we thank them for that.
And that speaks very highly of Chapman's and the fact that they are willing to reach out beyond our community to help others in other communities as well, which I think is important. So you have released about non-essential travel with some guidelines around personal service settings, minor hockey and sports and businesses. I'm wondering if you would elaborate a bit on the public health unit expectations around businesses, as we're in green, but not everyone is.
Another excellent point, and I thank you for bringing it forward. It is actually the thing that keeps me up at night this week. Anytime we close 1 door in emergency, 2 doors open, and this is one of them. The fact that we've been very successful in managing the pandemic here would create discrepancy in the level of risk between our area and neighboring areas. And the fact that one of these areas is in the gray, which is a complete lockdown, means their businesses and activities are closed, and people are tired, and they will have to, act in a way, based on that level of stress. So we'd expect some people to actually come to Grey Bruce to use our services. And as long as it's done in a safe way and we have the level of risk, that's quite all right. Some of these activities, hockey is recreational, personal settings is a higher risk of interaction. So we identified these 2 areas as areas where we need to emphasize a bit more communication. The communication goes to everybody in the community to remain committed to the vigilance in practicing the 3 W's, and specifically for workers in this industry or these 2 settings to be more vigilant, extra vigilant. And it is recommendation to the business owners, the operators. It's not regulations. We're not asking them to turn away people, rather recommendation if they wish to consider turning people away based on address, to do so. We had feedback from many of them to say, I have my customers, I know I'm comfortable with their risk, and I know I'm implementing everything I can, but we don't want to be heavy-handed to say, you shall not serve, and that's not the best practice. Carol, we use a principle in public health. Actually, I use it quite a few times per day, actually, when I make decisions. The least intrusive principle. If education does the job, there's no need for a warning, there's no need to escalate for an order or enforcement. And in this case, we have had education taking care of people coming to Grey Bruce in the summer. And this is a point to reassure our residents. Many people get anxious about the visitors coming. The visitors coming, they came during the summer and in thousands to beaches. There was not a single reported case, transmission to a Grey Bruce resident, or transmission between visitors who went back to their health units. And we used to track that with other health units. Some health units abandoned contact tracing. Nevertheless, we had at least 6 months of data. The businesses in Grey Bruce have been doing amazing work, ensuring the safety of the residents, the safety of the visitors and their staff. And we asked them to do a bit more considering these 2 categories. And hopefully within 2 weeks or so, our neighboring health unit will lower the risk of a transmission, and their facilities will open, so there isn't going to be that discrepancy going forward. Nevertheless, this is the final point on the subject. We are monitoring the situation, and we monitor the level of complaints from the businesses, how much they are seeing this type of travel than non-essential travel, and we can definitely use more robust approaches or more intrusive approaches if the need be, including communication with the ministry to consider that discrepancy and different accent and level of risk between the two areas.
From a business perspective, I think that it's hard. They've struggled, no doubt about it. It's their livelihood. This is where the community needs to continue to support our local businesses, because people coming in to bring business in, recognizing they're from out of the region, it's really challenging when you're struggling to survive. And this is where supporting each other and supporting our local businesses also supports the health unit recommendations, correct?
That is an excellent point. I wish I heard it early in the day. I would have said it. And in principle, we factored in this, although I didn't say it early, the fact that it's recommendation and the strong encouragement to businesses so they can evaluate the two things, the viability of the business versus the risk of transmission, and they can make that decision, and I'm in support of their decision either or. And it has been the feedback from businesses that they appreciated this recommendation because they can use it when they see fit, and they can skip that recommendation for a few days or for a week, depending on the viability and the number of customers they have.
And I think having the freedom to be able to implement the recommendations for businesses and anyone is really critical, that there are choices and you have the ability with guidance to make those choices.
Definitely, like you hear about certain jurisdictions, didn't happen in Ontario where they had a curfew. I do believe the day we issue a curfew, we lost the war against COVID, because it just says, I don't trust you as a public. And the success in Grey Bruce, I can say it firsthand, it's based on the trust that the public has been informed, engaged, and not afraid, and they've been following the recommendation to the best of their abilities.
And this is one of our strengths, is in the trust and in the relationships we have with each other. And I certainly value that as well. Dr. Arra, as always, there's information, current information, as the landscape changes almost hourly, never mind daily. Please join us again to share information. We rely on your wisdom and knowledge to help us move through this. Thank you for all that you and your staff are doing.
Thank you, Carol. And if I may just say that everybody to stay calm, stay positive, and test negative, and that'll be a good day. Thank you.
Excellent. Thank you to our viewing audience for joining us. Please join us again to learn more about programs, services, and resources available to you and to your family. Please take care and stay safe. Thank you.